Do you want to feel like $1,000,000? Stay tuned to learn how you can get a better night's sleep.
Welcome to Real Food, Real Medicine, where Chef Dr. Margie empowers you to better health through real food, to your health and wealth.
Now, we'll break sleep disorders down into 15 categories with solutions. This will be a relatively long video, but if you hover your mouse over the timeline below, you can see the chapters of each category and skip to your specific area of interest. I recommend you view the entire video, however, because many of these conditions overlap. Sleep is a complex process, and getting to the root of sleep disturbance can require a fair amount of exploration into the cause or causes of sleep. Sleep hygiene tips will be scattered throughout the individual categories discussed as well. This slide depicts 15 broad categories of reasons why sleep may be impaired. These categories are not listed in any particular order of occurrence. Let's go through each of these in greater detail. Number 1, pain. Pain from any source can lead to poor sleep. It's best to find out what is causing the pain to apply the effective remedy. Taking over-the-counter pain relievers is an option for a quick fix, but if the pain is due to tendinitis, for example, splinting or taping the area may also be needed, or maybe exercising the area to improve body mechanics is what's needed. Sometimes better positioning with pillows in bed will help alleviate pain at night. Check out the link in the description below for an example of orthopedic pillow that can help with body positioning and joint pain at night. If these simple fixes don't help, it's time to get a professional opinion. Number 2, temperature disorders. This includes such things as hot flashes, fevers, chills, hypothermia, hyperthermia, heat intolerance, and cold intolerance. Acetaminophen or ibuprofen is helpful for fever and chills. Black cohosh is an over-the-counter remedy that can help with hot flashes. There are also prescription medications available for hot flashes. Get professional help to determine if hormone therapy or other therapies are needed for temperature dysregulation. Number 3, gastrointestinal disorders. Conditions such as acid reflux, nausea, vomiting, constipation, and diarrhea can interfere with a good night's sleep. Get to the bottom of these conditions and get appropriate treatment. Some things that don't require a doctor's visit include avoidance of caffeine and alcohol in the evenings. Eating lighter dinner earlier in the evening and then a small bedtime snack such as milk and a banana can improve some of these symptoms. Sleeping with your head and upper body in a slightly elevated position with a wedge pillow or elevating the head of the bed can also help with reflux disease. If these conditions are chronic, please seek medical evaluation because they can be due to a more serious undiagnosed condition. Number 4, fatigue. Fatigue is the obvious symptom of sleep deprivation, but there are many medical conditions that can also lead to fatigue. Some of the most common include anemia, COPD, snoring, and sleep apnea. Getting to the root cause of fatigue, especially when it is chronic, will require a thorough medical history, physical exam, and specific testing. Number 5, immune system disorders. Allergies and autoimmune disorders are a common cause of poor sleep for a variety of reasons. Fortunately, today, there are many treatment options available. For allergies, there are various over-the-counter antihistamines and steroid nasal sprays to reduce symptoms so that you're more comfortable. Some antihistamines, such as diphenhydramine, which is the generic for Benadryl, have the side effect of sedation, so this might be a good option to improve your sleep. Beware though, occasionally it has the opposite effect, causing insomnia. Autoimmune disorders such as lupus and rheumatoid arthritis can have physical symptoms that impede sleep. If you have an autoimmune disorder, seek a medical professional for appropriate treatment. Number 6, respiratory disorders and congestive heart failure. When breathing is impaired or if your blood oxygen level is low, this can impair sleep. The low oxygen level can also cause memory impairment and other problems such as aggravating cardiovascular diseases. These conditions need urgent and appropriate medical care. If nasal congestion is the problem, using nasal strips can help, but the cause of the congestion should be identified for more effective treatment. More serious respiratory conditions such as asthma and COPD need specific treatments. Over-the-counter medications are not sufficient treatments. Congestive heart failure also needs specific treatments. It goes without saying that smoking cessation is paramount.
Number 7, neurologic disorders.
There are many neurologic disorders such as seizure disorders, Parkinson's disease, Alzheimer's disease, dementias, and brain injuries that can affect sleep in various ways, from disrupting the brain's electrical activity or causing dysregulation of hormones such as melatonin secretion, which is needed for sleep. Also, as we age, we tend to produce less melatonin, which is one reason why sleep problems tend to increase with age. Using over-the-counter melatonin can be helpful to improve sleep, but neurologic conditions need specific medical treatments.
Number 8, mental health disorders.
Stress, anxiety, and depression are the most common mood disturbances that affect sleep, causing either too much or not enough sleep. Mild symptoms can be treated with stress reduction techniques. A weighted blanket may also be of help. I provide a link to a weighted blanket in the description below. Meditation, relaxing music or white noise, chamomile tea, a warm bath, reading, and praying are some ways to wind down for the night. It's also important to get adequate exercise during the day, which helps reduce anxiety and improves mood. There are some over-the-counter remedies such as SAMe, which is S-adenosylmethionine, and St. John's wort. More persistent symptoms require counseling and may also require prescription medications. Be aware that some of the medications used to treat these conditions can affect sleep, causing sedation or impairing sleep. Always let your healthcare provider know you are having sleep problems so the right medication can be prescribed. Another caveat: sleeping pills are not a long-term solution to sleep problems because they don't treat the underlying cause and can actually cause more problems than they fix.
Number 9, metabolic disorders.
Conditions such as diabetes, chronic kidney disease, and thyroid disorders have a negative effect on sleep. Poorly controlled diabetes leads to neuropathy or nerve damage that can cause foot pain and also affect temperature control, impairing sleep. Over-the-counter capsaicin cream and diabetic socks can help with diabetic foot pain. Supplementing with vitamin B12 and prescription medicines can also help with foot pain. Uncontrolled diabetes also causes frequent nighttime urination and can lead to chronic kidney disease, both of which impair sleep. Poorly controlled diabetes also increases nighttime hunger, impairing sleep. Toxin accumulations in the bloodstream from kidney disease can negatively affect sleep. Persons with chronic kidney disease can also have frequent nighttime urination. Thyroid disorders can affect your sense of temperature, causing cold or heat intolerance, which can also affect sleep. These are some of the examples of metabolic disorders, and they need urgent medical attention.
Number 10, sleep disorders.
There are various types of sleep apnea, obstructive sleep apnea being the most common. Neck positioning during sleep and weight loss are important measures to lessen obstructive sleep apnea, but many require sleep appliances such as CPAP or BiPAP devices that are fitted after a sleep study is obtained to determine appropriate device settings. Other sleep disorders such as restless leg syndrome can be treated with medications. A weighted blanket may also be of benefit in restless legs. A link to a weighted blanket can be found in the description below. Narcolepsy, night terrors, and other sleep disorders need specific medical treatments.
Medications, including over-the-counter products.
Some medications, such as antihistamines, cause sedation, which may be of benefit in helping you to fall asleep. Some medications, such as stimulant medications used to treat ADHD and bupropion, have a caffeine-like effect, inhibiting sleep. Did you know that some medications can also affect your body temperature, causing them to block the body's ability to sweat or regulate temperature in other ways? Some medications that can cause hyperthermia include amitriptyline. Diuretics can cause nighttime urination, impairing sleep. Statin drugs can cause muscle aches, which may impair sleep. Basically, any medication causing a side effect can negatively impact sleep. A medication review might be in order if you're having trouble sleeping.
Number 12, alcohol, caffeine, nicotine, and drug abuse.
Alcohol, caffeine, and nicotine affect the ability to fall asleep and stay asleep. Avoid these in the evenings. Abuse of other substances is also disruptive to sleep. Get urgent help to combat substance abuse.
Circadian rhythm disorders and shift work.
Circadian rhythm disorders affect the natural wake-sleep cycle, and these require specialized treatment. Shift work disrupts the natural circadian rhythm. Always strive for the same bedtime and wake-up time, even on weekends. But when that isn't possible, due to work schedule, work with your employer to minimize the sleep disruption.
Blue light from TV, cell phone, and computer screens.
Blue light suppresses melatonin release. The simple solution here is to turn off these screens in the evening so that melatonin levels are in the normal range. If you wear glasses, you can also ask for blue light blocking lenses.
Number 15, environmental factors.
These include such things as room temperature and amount of light present in the room, pillow and mattress quality, etc. Noise level is also important. Make your environment as comfortable as possible with no noise except for white noise, no light, comfortable room temperature, pillow, mattress, and sleep position. Use extra pillows to support painful joints. Use a wedge pillow or elevate the head of the bed if you suffer from acid reflux. A weighted blanket may offer additional comfort. In summary, if you're having trouble sleeping, take it seriously. Make changes necessary in your schedule and lifestyle. Discuss your medication use with your healthcare provider, as some medications can interfere with quality sleep. If you have any other tips and tricks that have worked for you, post them in the comments below. If these changes don't improve your quality and quantity of sleep, seek medical advice. In general, sleeping pills and pain medications have the potential to negatively affect your sleep. It's best to seek medical care to find and treat the underlying cause of your problems with sleep. When evaluating causes of poor sleep, it's helpful to treat the underlying reason of the identified cause. For example, if snoring is causing poor sleep, what's causing the snoring? Sometimes it's weight gain, or maybe it's positioning of the neck, or it may be enlarged tonsils. The root cause should be identified and treated. As you can see, sleep is a complex bodily function that serves many purposes, all of which we may not even be aware of. It's safe to say that sleep is vital to your health, and that too little or too much is not a good thing. Check out the Amazon links in the description below for orthopedic pillows and a weighted blanket if you feel these items may be of help to you. So, take care of yourself and get a good night's sleep. To your health and wealth.
Be sure to check all my links below to contact me, subscribe, shop, and join my team. Thanks for watching, and I'll see you again in the next video. From my kitchen and wine cooler to yours, I wish you a bon appetit. To your health and wealth.